First time we see somebody here, and I see patients with yourself, Dr. Hirsch. We see patients together. The first time, what we're trying to do is get a sense of where they're at, what their history is, who they are, what their goals are. Get a really good idea of their health history and their general overall health. And I feel like our job, oftentimes I'll use the analogy with patients of that we're gardeners tilling the soil and working the soil. Conventional oncology is more focused on, if this is using the garden analogy, conventional oncology is more focused on pulling weeds out. And when someone has cancer, just working the soil usually isn't enough. So they need someone to go out and pull the weeds out, and the conventional oncology with surgery and hormonal therapy and chemotherapy and radiation does a good job of eradicating the weeds in most cases. And our job is to work side by side with oncologists and to work on the soil, to work on the microenvironment that the tumor is growing in, to make that person to reach a level of optimal health as much as possible, and to make it their body so that it's not hospitable for cancer to take root and to grow. So what does that mean? That means kind of looking under the hood, looking in the garden to see what's out of balance. So we look at a tremendous amount of blood markers. We look at inflammatory markers like C-reactive protein and sometimes interleukin-8, interleukin-6, SED-rate. We're looking at micronutrient levels like vitamin D and B12, zinc, copper, which we talked about earlier. We're looking at blood viscosity levels because cancer cells like thick blood. So we're looking at galectin-3, and if that's elevated, we'll oftentimes use something called modified citrus pectin. We're looking at fibrinogen and D-dimer. If those are elevated, there's nutraceuticals that we can use to help bring them down. What else? We're looking at salivary or urine cortisol and DHEA testing to get a sense of the adrenals, which is affected by stress. And we'll make sure that DHEA levels are at their optimal levels. We'll oftentimes use nutraceuticals like adaptogen herbs or certain micronutrients that help to optimize cortisol levels for patients. We're looking at methylation factors, so we're looking at homocysteine, which gives us some idea of methylation. We're looking at a whole bunch of single nucleotide polymorphisms that we're getting through testing of usually 23andMe. Tells us how well the patient's methylating. And methylation is a very important metabolic process that affects DNA expression, affects detoxification pathways. So giving us an idea of where that's off, we can use the right nutraceuticals. Oftentimes it's various B vitamins like folate or methylated folate, methylcobalamin or hydroxycobalamin, which are B12. And we can kind of utilize our lab testing to make sure that who we're working with, we're getting them to optimal health. We're getting that soil to be as healthy as it can be so that it makes it least likely that cancer can take root in that person.